Garen?
Thank you, Tony. I'm going to follow their lead and be a good news, here's what we can do kind of guy, but not just yet. You've heard us all today working, as we are all accustomed to do, to justify consideration of violence as a health problem. We all have our ways of doing that. You've heard lots of those characterizations. We've heard about infectiousness. We've heard about outbreaks. Jeff Swanson started the day with that. There's been an outbreak today at a middle school in Nevada, and we'll all learn about that some more after the meeting is over. I like comparisons some, and I'm going to offer up this comparison to you, and it runs as follows. In the 45 years since the Gun Control Act of 1968 was established, we had got our modern regulatory apparatus for firearm commerce. More than 1,400,000 civilians in the United States have died from gunshot wounds. That exceeds by more than 200,000 individuals all the war-related casualties among our military, whether from gunshot wound, any other injury, or disease, all causes combined since the beginning of the Republic. Let me offer another comparison. We've heard some allusions to this today. I'm going to get a little bit specific. We're looking here at the moment at death rates from two causes. The graph, I think, is self-explanatory. I was hoping to give you the 2012 update, but thanks to the shutdown, those data were not available as of noon today. 2011 was available by this time last October. But let's start with motor vehicles. Can you all see that rapid rise in the upper left-hand corner of the graph on the blue line? It's the late 50s, early 60s. We're experiencing an epidemic. The country did what it does best. We mobilized. We created an entire federal agency with a mission to drive those numbers down. We, being smart people, put a physician in charge, an internist epidemiologist by the name of Bill Haddon. Not too long after Bill Haddon took control of that agency, it's now known as the National Highway Traffic Safety Administration, the nation embarked on an aggressive program of research and policy development related to that research. We learned early on that education was not the answer, and we deliberately sought out other approaches to the problem, and you can see what happened to the curve. It went flat. And since then, not steadily, but over time, it has gone down to the point that in 2011, within the margin of the instrument I'm using to present the data to you, the curve intersects with that for firearms. Where by contrast, over and over and over again, we have made as a nation consistent, conscious policy decisions to turn our backs on the problem. The one bright, shining exception to that was the program at CDC that Mark Rosenberg ran and has talked to you about. Mark, it is very nice to see you again today. And more about Mark and his program in just a minute. But as a result of that lack of inquiry, we don't know clearly why rates of firearm violence went up in the 60s. More sadly yet, we don't know why they went down so rapidly in the late 1990s, although there are multiple complementary theories. And we tend, frankly, to simply ignore the fact that they haven't changed in more than a decade. You can read in government publications released in the last year, you can read in a major study published by the Pew Charitable Trusts about the large decrease in rates of firearm violence, homicide and suicide over the last, rates of the decrease, but their point of comparison is the early 1990s. There is simply no reference made to the fact that we ain't making no progress in this area, and we haven't in a long time. But there are some individual policies that work. I'm going to spend the rest of my time very briefly reviewing some of that research. I'm going to mention here that all of what I'm going to present to you is work that was initiated by CDC, that was funded by others when CDC's program was shut down. Had it not been for CDC and some private funders' willingness to take some risks, none of what I'm about to show you would be available. We're going to talk about the nation's efforts to deny purchases of firearms by people who are at high risk, to identify those people and prevent them from acquiring their firearms. You know that we do that for felons. We do that for people who've been convicted of domestic violent misdemeanors. we do it for some others. We do it only when the purchase is through a licensed retailer, and bear in mind that 40% of all firearms transfers don't involve a licensed retailer. There is no background check. There is no record keeping. Hint, hint number one about something that we could do. But the first research question that comes up is, do the prohibitions that we have in effect in the country cover the population at risk? The answer is no. And I'm going to give you a very specific answer. This is from a cohort study our group did of people who legally purchased handguns. They purchased their handguns in California quite some time ago now. In the late 1970s, we followed them for up to 15 years. What you're looking at the table in the bottom is simply the incidence of arrest. Top row, people with no prior arrest record, law-abiding gun owners. Bottom row, people with at least one prior misdemeanor conviction at the time they purchased their firearms. Let's call them not so law-abiding gun owners. But I stress, these purchases were legal. And you can see the results across the two rows. 10% of those with no prior criminal history arrested over 15 years, 50% of those with at least one conviction, and an incidence ratio of roughly 5 to 1 right across to the right, where we look specifically at the offenses of murder, rape, robbery, and aggravated assault. Sticking with that same study, let me shift the outcome a little bit, the analysis a little bit. The data table on the right now is presenting to you relative risks. The referent group in all cases is those who have no prior arrest record. And on the left-hand side of the table, we're stratifying the exposures a little bit. So first off, in the top row, those who have a misdemeanor conviction, 1, or in the second row, 2 or more, but none of those convictions involve either firearms or violence. Second pair of rows, and these assignments were made hierarchically, those who have 1 or 2 or more convictions involving firearms, but none involving violence, nonviolent weapon carrying, let's say. And finally, those who have 1 or 2 or more prior misdemeanor convictions for violence. And I'll just cherry pick and hit the number at the lower right-hand corner of the screen and point out that we see here a risk ratio of 15 to 1. I'm going to stress again, those purchases were legal in most of the country. They still would be. But California did something about its violent misdemeanors. We changed our policy. We said, beginning in 1991, if you've got a violent misdemeanor conviction, you can't buy a gun anymore. Our group stepped up and said, let's do the evaluation. The hypothesis, Tony, I promised you a hypothesis, was that the law wouldn't make any difference. We had 2 groups of violent misdemeanors who sought to purchase handguns. They were eerily similar in all the variables that you might want to adjust for, and we adjusted for those variables. The difference was one group didn't get their handguns because they sought to purchase them in the first year of the new law. The comparison group did. This is my last slide. Excuse me. We took executive privilege here. I might have done it the other way around if I had it to do over again. We are looking at relative risks, comparing those who acquired their handguns to those who did not. Among the 2 populations altogether, those who acquired their handguns had a 30% increase in risk of arrest over 3 years of follow-up for offenses involving guns or violence. Those ages 21 to 24, when the absolute incidence was highest, a 40% increase. And you can scroll on down, I'll scroll right to the bottom, to those with 3 or more prior convictions for firearms or violence. It made no difference. And I suspect that there is a group with a well-established history of prior criminal activity who do go out and find a firearm by other means if they can't buy one legally, but that was a very small subset of the population. And I will end with this observation. Look at the column on the right. No difference whatever for the offenses that were beyond the scope of the law. A specificity of association that in this observational study we used to infer a high probability of causality related to the passage of the law. And I will stop there. Thank you.